Dear colleagues, I'm Christoph Diener from the Faculty of Medicine at the University of Duisburg-Essen in Germany. What I usually do is that I report 5 or 6 studies in the field of neurology which were published in the last months, but July obviously was a vacation month, so I decided to cover another topic, which is the role of GLP-1 and GIP agonists beyond diabetes mellitus and obesity, and in particular for the field of neurology and psychiatry. Until a few years ago, the treatment of diabetes mellitus with traditional antidiabetic drugs was frustrating for a vascular neurologist. These drugs would lower glucose and had an impact on small vessel disease, but they had no impact on large vessel disease and stroke and vascular mortality. And this changed with the CGL2 antagonists, because these drugs were not only effective for diabetes, but they also lowered cardiac mortality, in particular in patients with cardiac failure. And the next generation of antidiabetic drugs were the GLP-1 agonists, and GLP-1 stands for glucagon-like peptide, and the combined GLP-1 agonist, and GIP stands for glucose-dependent insulinotropic polypeptide. And these two polypeptides and the receptors play a very important role in diabetes and in obesity. And the receptors are not only found in the pancreas, but also in the intestinal system, in the liver, and in the central nervous system. And we have a number of preclinical models, mostly in transgenic mice, which show that these drugs are not only effective in diabetes and obesity, but also in liver disease, in kidney failure, and in neurodegenerative diseases. And GLP-1 agonists also have powerful anti-inflammatory properties. So these drugs reduce body weight, and they have positive effects on blood pressure and lipid metabolism. And in the studies on the use of GLP-1 agonists in diabetes mellitus, a meta-analysis with more than 58,000 patients showed a significant risk reduction for stroke compared with placebo, and this risk reduction was in the range of 80%. And a meta-analysis on the use of GLP-1 agonists in obesity and non-diabetic patients with over 30,000 patients found a significant reduction in blood pressure, in mortality, and in the risk of myocardial infarction. But there was no significant decrease in the risk of stroke, but most probably this is due to the fact that strokes are much less frequent in obesity than in diabetes. Now, you all know that obesity is also a major risk factor for sleep apnea syndrome, and recently 2 large studies with the GIP-GLP-1 agonist tirzepatide found a significant improvement in sleep apnea syndrome compared to placebo, regardless of whether patients needed CPAP therapy or not. Now, in the therapy studies on diabetes and obesities, there were indications that some smokers in the study stopped their nicotine consumption. And a small pilot study with exenatide in 84 patients who were overweight and smokers showed that 46% of patients on exenatide stopped smoking, compared to 27% in the placebo group. And this could be an indication that GLP-1 agonists have activity on the reward system in the brain, and currently there are a number of larger placebo-controlled trials ongoing. Another aspect is alcohol consumption, and an epidemiological study in Denmark using data from the National Health Registry showed that the incidence of alcohol-related events decreased significantly in almost 40,000 patients with diabetes when they were treated with GLP-1 agonists compared to other antidiabetic drugs. And a retrospective cohort study from the United States with over 80,000 patients with obesity showed that treatment with GLP-1 agonist was associated with a 50 to 60% lower risk of the occurrence or recurrence of high alcohol consumption. Until now, there is only one small study with exenatide, which was not really informative. There are a number of studies underway for GLP-1 agonists compared to placebo in patients with alcohol dependence or alcohol consumption. And preclinical models also indicate that these drugs might be effective in cocaine abuse, as there is one placebo-controlled study ongoing. Now let's come to neurology. Preclinical models have shown neuroprotective activities of GLP-1 in models of Parkinson's disease. And until now, we have 3 randomized placebo-controlled trials with exenatide, NA101, and lixisenatide. And 2 of these studies were positive, showing that the symptoms of Parkinson's disease were stable over time and deteriorated with placebo, and 1 study was neutral. And this means we need more studies, large-scale placebo-controlled studies in the early phases of Parkinson's disease. Another potential use of GIP, GLP-1 agonists is in dementia. These substances, as you know, have positive effects on high blood pressure and vascular risk factors. A working group in China analyzed 27 studies on the treatment of diabetes mellitus. In these small number of randomized studies and a large number of cohort studies showed that modern antidiabetic drugs reduce the risk of dementia. The risk reduction for dementia for the GLP-1 agonists was 75%. At the moment, there are only small prospective studies, and they are not conclusive. And again, here we need large-scale placebo-controlled studies. The most important limitation at the moment beyond the cost is the other adverse drug reactions with the GLP-1 agonist, and these include nausea, vomiting, diarrhea, and constipation. There might be a slightly increased risk of pancreatitis. The FDA recently reported there is no increased risk of suicide. And another potential adverse drug reaction is non-atherosclerotic anterior optic neuropathy. These drugs, GLP-1 agonists and GIP agonists, are also investigated in a variety of other non-neurological diseases. The focus here is on metabolic liver disease, such as fatty liver and kidney diseases. And smaller positive studies have been conducted in this area, and large placebo-controlled trials for both indications are currently underway. Now, if these diverse therapeutic properties would turn out to be really the case with GLP-1 agonists, this would lead to a significant expansion of the range of indications. But if we consider costs, this would be the end of our healthcare systems because we cannot afford this. And in addition, the new antidiabetic drugs and the treatment of obesity are only available to a limited extent. And finally, at least for neurology, it's unclear whether the impact in these diseases is in the brain or whether it's an indirect efficacy due to the effectiveness on vascular risk factors and concomitant diseases. So in the next 5 years, we will learn whether GLP-1 or GIP-GLP-1 agonists are the new wonder drugs in medicine. Dear colleagues, I am Christoph Diener from the medical faculty at the University of Essen. Thank you very much for listening and watching.